Ever been in that dental chair, maybe a bit on edge, and then felt that, that relief when the numbness kicks in?
Oh, yeah, that wave of numb. It's almost magical.
Totally. But it's not magic, is it? Have you ever stopped to think about the incredible precision involved?
Exactly.
Today we're doing a deep dive into one very specific technique. The middle superior alveolar nerve block. You'll often hear it called the MSAN Block. Our mission, to unpack what it does, where it works, and honestly, a really fascinating anatomical twist that might surprise you.
And it's worth understanding, I think. Even these seemingly routine procedures, like getting numb,
Yeah.
they rely on such detailed knowledge of how we work, how our bodies are wired.
It really gives you a new appreciation.
It does, especially for things we often just, take for granted.
Okay, so let's get specific. The MSAN Block, what's it for? Primarily, it's designed to numb the upper premolars. Those are your first and second premolars, right behind the canine teeth.
Right, those two.
But here's a pretty cool detail. It doesn't happen for everyone, but in about 28% of people. It also numbs the Mesiobuccal root, that's the front outer root of the first molar.
Which is interesting because usually you'd think of a different block for the molars.
Exactly. And it's not just the teeth.
No, it also gets the associated buccal periodontium and gingiva. So the gums on the cheek side of those specific teeth.
And even, kind of surprisingly, a little bit of the lining inside your maxillary sinus, right above those roots.
That's right, which tells you how close those tooth roots are to the sinus floor. It's amazing targeting.
So how is that possible? What's the anatomy behind it?
Well, it all comes down to the nerve itself. We're targeting the middle superior alveolar nerve, the MSA nerve.
Okay.
And this nerve, it's a branch off a larger one called the infraorbital nerve.
Infraorbital. Okay, I've heard of that one.
Yeah, and the infraorbital nerve, in turn, comes from the maxillary division that's V2 of the trigeminal nerve, cranial nerve 5.
Ah, the big one. Responsible for so much sensation in the face.
The very one. So you've got this pathway. Trigeminal V2 gives rise to the infraorbital, which then gives off the MSA branch right around there. It's this network that allows for such specific numbing.
Like finding the right wire in a really complex circuit board?
That's a great analogy, yeah. Pinpointing that specific branch is key.
So how do they actually do it? The technique, I mean. Briefly. Generally, the injection site is just above the apex, the very tip of the root of the upper second premolar.
High up in the vestibule there.
Right. And the idea is to aim towards the infraorbital foramen, that little opening in the bone under your eye socket where the bigger infraorbital nerve comes out.
But you're not actually going to the foramen?
No, definitely not. It's about depositing the anesthetic near where that MSA nerve branches off, before it enters the bone to supply the teeth.
Precisely.
Okay, that seems fairly straightforward, targeting that nerve. But here's where it gets, really interesting. This is the part that blew my mind a bit.
Ah, the twist.
The twist. That middle superior alveolar nerve we've been talking about this whole time.
Yeah.
It's not always there.
Exactly. It's absent in a significant number of people. The anatomy isn't standard across the board.
Wow. Okay, so what happens then if you go to numb the MSA nerve and it doesn't exist in that patient?
Well, nature finds a way, usually. If the MSA nerve is absent, its job innesting those premolars, and maybe that molar root is typically taken over by the nerves on either side.
Meaning?
Meaning the anterior superior alveolar nerve, the ASA, which usually handles the front teeth, and the posterior superior alveolar nerve, the PSA, which handles the molars further back. They sort of spread out their coverage.
Okay. So the area still gets nerve supplied just from different branches.
Correct. And that means the dentist has to adapt. If an MSAN block doesn't work, or if they suspect the nerve might be absent based on other factors, they can't just rely on that one injection.
So they'd need to do something else.
Yes. They'd need to use a combination of an ASA block for the front part of the area and a PSA block for the back part to effectively numb the premolars. They essentially have to cover the territory that MSA would have covered.
That's fascinating. It's like real-time anatomical problem solving.
It really is. It highlights how dentists need to understand not just the textbook anatomy, but also the common variations. It's personalized care right there.
Absolutely. Okay, so let's quickly recap.
Yeah.
The MSAN block is super specific for those upper premolars, sometimes the first molar root too.
Right.
Targeting that middle superior alveolar nerve.
If it's there.
If it's there. That's the kicker. Its absence means dentists need a plan B using the ASA and PSA blocks. It really makes you think, doesn't it?
It really does. It shows how these Subtle anatomical differences between individuals can have a direct impact on everyday procedures. It's not just abstract knowledge.
Yeah.
And it gives you, I hope, a deeper appreciation for the complexity hiding beneath the surface. The next time you're getting numb, maybe just take a second to consider the incredible amount of knowledge, skill, and adaptability that goes into making sure you, specifically, are comfortable.
It's a testament to understanding our unique bodies.
Truly, working with, not just against, those beautiful variations in human anatomy.